Hi, my name is Margaret Prietz. I live in Midlothian, Virginia, and I would like to tell you my story of my trigeminal neuralgia escapades.
You're here in Houston, Texas, right?
Right in Houston, Texas right now, visiting some friends, long-time friends since 1972 when I first moved to Houston, and that's when my story began. I had some pain in my tooth here, very minimal, very tiny. Went to a dentist, told me there wasn't anything wrong with my teeth. Went back to my place where I was born and raised, which is Baltimore, and my uncle was my dentist. Went to him, told me there was nothing wrong with my teeth. Through the years, the time span in between episodes got shorter and shorter. They started out maybe 3 years apart, and I would get little twinges for half a day. And as the years went by, the time span went from maybe 3 years to 2 years and 9 months, 2.5 years. And then the episodes would last maybe day and a half, till eventually it got to the point where they were lasting for 3 weeks at a time. Somewhere in between, I really don't remember. I could not eat, could not chew, could not swallow. Went to a neurologist in Houston, but unfortunately don't remember the name. He did give me some Tegretol, which killed the pain. Was on that and kind of back and forth to different places I lived, went to doctors, kept on Tegretol until 1989 when I went to the gynecologist for a yearly checkup and told me I had to get off the Tegretol because my blood level was so low. At the time I was only taking half of 100 milligrams twice a day. So that was only 50 in the morning, maybe 50 in the evening. But for some reason, I have an extremely low tolerance to drugs. And he told me I had to get off of it because I had learned that if you continue on, your blood level, your low white blood count can get so low that they can't bring it back up. And then you become easily acceptable to all kinds of illnesses and diseases. I told him I couldn't get off it. I wouldn't be able to eat, chew, swallow, do anything. So at that time, Dr. Singh, Sahni in Midlothian, got in touch with him through a friend in the choir, had one of the injections. And that lasted from September of 1989 until approximately August of 96, during which time I had a nosebleed. A very severe one, lasted for like 2.5 hours. I've never had a nosebleed before that and never had one since. And I had my nose packed. During that week, I started getting twinges again and realized that I thought this was coming back. I was kind of self-medicating myself that December, beginning of December through the middle of January of 97. And taking just enough so that I could manage the pain, but it was still there. Then it got to the point where I thought, I can't keep doing this. Went to one neurologist, well, he didn't care for him. Then went to another, went in after Dilantin, Tegretol, time-release Tegretol, Neurontin, different dosages of Neurontin. Nothing was working, and that was when he said, I think you need to go back to see Dr. Sahni again, which I did, and after an MRI, he decided that we should do the MVD, which I had done the first time May 8th, 1997. And unfortunately, that worked for a while, but then by August of that year, I started getting very minimal twinges. By September, they were getting worse, and by October, it was just horrendous. And that October, usually I was able to sleep, didn't have any problem sleeping, because I don't move around a lot. But that time I had been up for 5 days, hadn't eaten, couldn't sleep, couldn't do anything, and gave me another injection. That lasted until, I'm trying to think, actually I can remember the date, April 4th of 1998. And I took a sip out of a water bottle, and it was like somebody jabbed me with a huge, gigantic knife.
We're going to cut the tape now. We'll go to tape 2.